I thank Dr. Juan Pablo Lievano for dubbing this video in English.
Receive a warm greeting. I'm Andrés Ferro, medical doctor and plastic surgeon, professor of plastic surgery at the Bosque University and at the Colombian National University, and undergraduate professor of plastic surgery at the Rosario University. I'll present a series of videos and practices aimed at developing skills for students, interns, and general doctors in surgical suture techniques. Today, we will start by the principles of the suturing workshop. I hope this is very useful for you.
To carry out the practices, a porcine skin model or bacon is recommended. It's cheap and easy to get. It's important for it to be fresh, not frozen, thin and soft. This way, the specimen behaves similarly to human skin, allowing incisions, the passage of needles, and the knotting of sutures. A segment of 15 centimeters wide and large is enough for the practices. On most of the dissection equipment, you will find two different scalpel handles, number 3, which is smaller, and number 4, which is bigger. For the number 3 handle, the corresponding blades are numbers 10, 11, 12, and 15. And for the number 4, numbers 20, 21, and 22. For these practices, the most suitable blades for handle number 3 are the numbers 10 and 15, and for the number 4, anyone is suitable. The ideal needle to work with bacon must be sharp. This needle has a cutting-edge vertex that allows, in bacon as well as in human skin, penetrate the dermis, the most resistant layer of the skin, and make the sutures. The ideal suture material must be 4/0 or 5/0 gauge, ideally monofilament, although any suture works. To make sure that the suture comes with a cutting needle, note on the package under the needle outline a triangle that means it's a cutting needle and not a blunt one. In order to do these practices, you won't need surgical or sterile gloves. Exam gloves will be enough. If you have surgical gloves, it's worth doing the exercise of putting them correctly. Without contaminating them, open the package, taking the gloves out. Identify the right and left glove. Take the gloves and oppose each thumb, left and right. Grab them in the center. And this way, introduce your right hand through the right glove. Then, on the sterile part, grab the left glove with your sterile right glove. And this way, fix it and introduce your left hand. For the practice, you will require a dissection equipment consisting of a scalpel handle, material scissors, claw dissection forceps, and a needle holder. To start the practice, open the scalpel blade that corresponds to the handle that you're going to use. Grab it with the needle holder and fix it on the scalpel handle. When the practice is over, separate the scalpel blade from the handle with the needle holder. Advance it and remove it. Carefully dispose the blade in a puncture-proof container. Also, all the cutting elements, like needles, must be safely disposed in a puncture-proof container. Finally, I want to thank Dr. Maria Camila Rojas and Dr. Juan Pablo Lievano, medical doctors from the Rosario University, for their collaboration on taping and editing these videos.